Chapter 2, that is the guideline for the neoplasm, and we'll begin with the understanding what is benign tumor, what is malignant tumor, and then we'll go into the detail. So the chapter 2 mainly consists of the neoplasm code, which begins with the letter C and it goes on till the letter D, and it has the various the guideline. These are the chapter specific guidelines. This is the 2026 guidelines. So we'll go into the detail of each and every guideline. Now, before going into the chapter, one must understand the different classification and the type of the neoplasm. Primary malignancy is referred to the original site where the cancer has developed. Secondary malignancy occur when the cancer spread to another part of the body or when the primary tumor invades the adjacent tissue, forming a new malignant growth, which is also called as a metastasis. In-situ malignancy, a cancer that remains confined to its place of origin and has not invaded the surrounding tissue. Usually it has a very thick lining, so it doesn't invade the surrounding tissue. Benign tumor, a non-cancerous growth made up of abnormal cells that do not spread to other part of the body. Uncertain behavior used when a healthcare provider cannot determine whether the neoplasm is benign or malignant. 6 is unspecified neoplasm, applied when there is insufficient information in the medical record to classify the neoplasm or assign a specific diagnosis code. So this is the neoplasm table which is there in your book. Here the name of the organ from where it is originated, and these are the various types of neoplasm which we have seen. The primary we will look in this particular column, the secondary, then in situ, then there is a benign, then uncertain and unspecified behavior. Now let us understand how to use the neoplasm table alphabetical index to navigate through this chapter. Steps for coding the neoplasm by site. So if the neoplasm by site is given, start with the neoplasm table in the alphabetical index to locate the correct entry. Then select the appropriate column in the neoplasm table, whether it is a primary, secondary or benign based on the documentation. Third, verify the chosen code in the tabular list to ensure it accurately reflects the correct site and behavior, and there is no more specific code available. Now, let's assume that the histological term of the neoplasm is given. So, for that, if a histological term is documented, look up the histological term first in the alphabetical index to determine the correct column in the neoplasm table. For example, the term adenoma, if it is given, first we'll look up the adenoma in the alphabetical index, then follow the instruction. So in front of the adenoma, you will see that they have written C neoplasm benign by site. So here I get the instruction that I am supposed to go to the neoplasm table, but I got the clue that adenoma, it is a benign tumor. So if it is an adenoma of a particular site is given, now I will go to the neoplasm table. I know the site and then I look into the benign column. Then what I will do is, then I'll pick up the code and see the code finally in the tabular list for the specificity. So this is how I will use the neoplasm table. Next guideline is primary malignant neoplasm overlying the site boundaries. When a primary malignant tumor overlaps two or more contiguous sites, assign 0.8 overlapping lesion code for that organ, unless the specific combination is listed in the index. If there are multiple tumors in the same organ that are not contiguous, that is, example, different quadrant of the same breast, assign a separate code for each site. So let us take example, the colon cancer overlapping segment. Malignant neoplasm involving the cecum and ascending colon. So you see here that there is a cecum and immediately there is a ascending colon. So in this case, I will use the code C18.8 malignant neoplasm of the overlapping site of the colon. And this is how I will write the code. So the next guideline is malignant neoplasm of the ectopic tissue. Malignant neoplasm arising in the ectopic tissue are coded to the site of the tissue origin or the tissue type, not the location where they are found. So let us take one example for you to understand. Ectopic pancreatic cancer found in the stomach. In this case, we are going to code C25.9 because it is the pancreatic cancer. So we will be coding the pancreatic cancer. We won't code where it is found because that is immaterial. But what is the original tissue? It is a pancreatic tissue. Next is admission encounter for the treatment of the primary site. If the encounter or the admission is for the treatment of the primary malignancy, assign the primary malignancy as the principal or the first listed diagnosis, followed by any metastatic site. The only exception is when the encounter is chiefly for the administration of the chemo, immuno, and external beam radiation therapy. In that case, assign appropriate Z51 code as the principal or the first listed diagnosis, with malignancy being treated or reported as a secondary diagnosis. So in short, when you are treating the cancer directly, code the cancer first. If you are receiving the therapy, code the treatment first and then the cancer. So let us take one example that a patient is admitted for the surgical removal of the malignant tumor in the colon. Now in this case, why the patient has been admitted malignant tumor of the colon, and that is the that will be your principal diagnosis, and secondary diagnosis is any related complication or secondary malignancy, because here the patient is admitted for the treatment of the primary cancer. So let us see the next guideline, admission encounter for the treatment of the secondary site. When the patient is admitted for the treatment of the metastatic cancer, code the secondary neoplasm as the principal diagnosis. This applies even if the primary cancer still exists and is not being treated during the encounter. Basically, when you are writing the secondary neoplasm as a principal diagnosis, you are trying to tell that the patient has come for the treatment of the secondary neoplasm. So let us take one example. Rita with a breast cancer that has metastasized to the liver is admitted for the treatment of the liver metastasis only. So in this case, what will be the principal diagnosis? The principal diagnosis is her secondary malignant neoplasm. It doesn't matter whether she has the primary still there. So like in this example, the primary malignancy is still there, but right now the treatment is directed at the secondary. So this is the way we will write it. So we will go to the neoplasm table. Under the site liver, we will see into the secondary malignant column, and then the code will be C78.7 secondary malignant neoplasm of the liver and intrahepatic bile duct. So remember, the spread is in liver, so we come to the site and see it in the secondary column. And as far as the primary is concerned, we will see the organ side, that is breast, and under the malignant primary we will pick up the code. After this we'll go to the tabular list because I can see the dash as well as the correct sign, and irrespective of that one must go to the tabular list and then we pick up the code, and C50.919 will be my second code. Next is coding and sequencing of complication. Anemia associated with malignancy. When a patient is admitted to the management of the anemia caused by the malignancy, and the treatment is directed only towards the anemia, not the cancer, code the malignancy first as a principal or the first listed diagnosis. The anemia is a manifestation of the cancer, and code the anemia second. So here the anemia and the malignancy, they act like a disease and a manifestation. So let us take example. The patient with colon cancer develop anemia due to the cancer and is admitted for the treatment of the anemia only. How will I code? So in this case, the principal diagnosis will be the cancer because that is the cause, while the secondary diagnosis will be the anemia in neoplastic diseases because that is a manifestation. So let us take one next guideline, anemia associated with chemo, immuno or the radiation therapy. When the admission is for the management of the anemia that occurred as an adverse effect of the anti-neoplastic therapy and only anemia is treated, then in that case we sequence the anemia code first. Second code is the neoplasm code, and finally we add the adverse effect code for the therapy because here anemia is an adverse effect of all these therapies. So let us take one example. The patient with a breast cancer developed anemia caused by the chemotherapy and is admitted for the treatment of the anemia only. So in that case, the principal diagnosis is the anemia due to antineoplastic chemotherapy. Second code is for the neoplasm, and additional code is the adverse effect of the antineoplastic and immunosuppressive drug. This is how we code it. Now we will take the next guideline, that is management of dehydration due to malignancy. Now when the patient is admitted for the management of the dehydration that is caused by an underlying malignancy and the primary treatment provided is for the dehydration is coded first followed by the code for the malignancy. This reflects that the reason for the encounter is dehydration even though the malignancy is underlying cause. So let us take one example. Patient with known metastatic colon cancer present with a severe dehydration due to poor intake from the cancer. The hospital admission is solely for the IV rehydration. No chemotherapy or the cancer directed treatment is provided during the encounter. Now, in this case, the first code is mainly the dehydration because the patient has been admitted for the IV rehydration, and then the second code you will write is of the malignant neoplasm. The next guideline is primary malignancy previously excised. When primary malignancy has been completely removed or eradicated and when there is no active cancer remaining at that primary site, there is no ongoing treatment directed at that site, and the provider documents no evidence of existing malignancy at that site. Then the code from category Z85, personal history of malignant neoplasm, is used to identify the former primary cancer site. If the patient has a metastasis to another site, that new site is coded as a secondary malignant neoplasm. And in this case, the secondary malignant neoplasm may be the principal or first listed diagnosis, and Z85 history code is listed as a secondary diagnosis. So each and every word is important, that there is no ongoing treatment, there is no active cancer remaining, and no evidence of existing malignancy. Then only we can use the personal history of malignant neoplasm. So pay attention to each and every word. So let us take example. Derek had a primary colon cancer completely removed 3 years ago. There is no recurrence at the colon site and the patient received no further colon direct treatment. Derek is now admitted for the evaluation and treatment of the liver metastasis that originated from the previous colon cancer. So in that case, we will write C78.7 secondary malignant neoplasm of the liver, and then we will have to mention the personal history of the malignant neoplasm of the large intestine, because it is written the colon. Colon is large intestine. So this is how we code it for the malignancy which has been primary malignancy which has been completely eradicated. Now let us take the next guideline, that is patient admission chiefly for the anti-neoplastic chemo, immuno or radiotherapy. Now when the primary reason or the encounter is for the administration of the therapy, then in that case for the chemotherapy we assign the code Z51.11, immunotherapy Z51.12 and external beam radiation therapy Z51.0. The appropriate code is the principal diagnosis. The malignancy being treated is listed as a secondary diagnosis. This happens when the patient's encounter is for the administration of the therapy. Now, encounters involving more than one type of therapy. If the patient receives more than one type of anti-neoplastic therapy during the same admission, for example, radiation and chemotherapy, immunotherapy and chemotherapy, then we assign the appropriate code together. One will be the principal, the other will be secondary, and there is no hierarchy as such. You can code any one first. So this is the new point that has been added into the guideline, that is implantation of the radioactive element. It is added in 2026. So when the encounter is for the insertion or the implantation of the radioactive material, the malignancy code is the principal diagnosis. Do not assign Z51.0. So the patient is admitted for the implantation of the radioactive seeds for the prostate cancer. So when we are talking about the radioactive seeds, we are not giving the radiation therapy, but we are just putting inside those seeds. So in that case, the principal diagnosis will be the malignant neoplasm of the prostate, because the visit is for the implantation, not the radiation, and we will not assign the code Z51.0 because it is for the external beam radiation therapy, because it is the code for the therapy, and here we are just putting inside the radioactive seeds. The next guideline is the episode of care involves surgical removal of the neoplasm. When the patient is admitted for the surgical removal of the neoplasm, either the primary or secondary, and during the same episode of the care, the patient also receives the adjunct chemo or the radiation therapy, then the code for the neoplasm is assigned as the principal or the first listed diagnosis, and the adjunct therapy is a secondary capture, not the principal reason. So, for example, Rita has a breast cancer and is admitted for a lumpectomy to remove the tumor. During the same hospitalization, she also received post-operative radiation therapy to the breast. So in that case, the primary code is C50.912 malignant neoplasm of the unspecified site of the left female breast. And that will be your principal diagnosis, and Z51.0 is encounter for the radiation therapy. Now, the symptoms and sign associated with the malignancy. Symptom and sign and abnormal findings from chapter 18 that are characteristic of or associated with an existing primary or secondary malignancy must not be assigned as a principal or first listed diagnosis. The malignancy itself must be sequenced as the principal diagnosis, regardless of how many times the patient is admitted for the symptom related care. So for example, the patient is shortness of the breath from the lung cancer. So the dyspnea caused by the primary lung cancer, the principal diagnosis will be the lung cancer. Remember, this is also the new guideline. So now the next important guideline is the pathological fracture due to the neoplasm. Now in this case, the important thing is one must understand why the patient has come. If the encounter is for the treatment of the fracture, then the sequence fracture first, followed by the neoplasm. But if the encounter is for the treatment of the neoplasm with an associated pathological fracture, sequence the neoplasm first followed by the fracture. So let us take two examples to understand this guideline. A patient with a metastatic breast cancer to the femur present with a pathological femur fracture. The admission is primarily for the surgical repair of the fracture. So in that case, we will code the pathological fracture in the neoplastic diseases, left femur. That will be my first code. Second code will be the secondary malignancy because this fracture happened because there is a metastasis from the breast cancer into this particular bone. And then the third code will be the malignant neoplasm of the breast. So this is how we will code it. Now, if the focus of the treatment is neoplasm, so a patient with a multiple myeloma has a pathological vertebral fracture but is admitted primarily to treat the malignancy, not for the fracture. Then in that case, we will code the multiple myeloma not having achieved remission. That will be my first code, followed by the pathological fracture in the neoplastic diseases and other specified site. So this will be my sequence in as far as the treatment is directed toward the neoplasm. Another new guideline is the malignant neoplasm in a pregnant patient. When a pregnant patient has a malignant neoplasm, first we will code it as O9A.1. That is a malignant neoplasm complicating the pregnancy, childbirth and puerperium. Second code will be the appropriate malignancy code from the chapter 2, that is C00 to D49, to identify the type and the site of the cancer. So let us understand this guideline by taking one example. A pregnant patient is diagnosed with breast cancer and is admitted for the evaluation and management of the malignancy during the pregnancy. Now, whenever we hear the word pregnant patient, the first code has to be O98.113, malignant neoplasm complicating pregnancy, third trimester. That will be my principal diagnosis. And then the second code will be the C50912, malignant neoplasm of the unspecified site of the left female breast. So this is how I will code as far as this guideline is concerned. So the only way to understand the guideline is by taking questions. A patient with a metastatic bone cancer present to the oncologist office for a chemotherapy treatment. On examination, the oncologist finds the patient to be severely dehydrated and conceals the chemotherapy. The patient will receive the intravenous hydration in the office and reschedule the chemotherapy treatment. What ICD-10-CM code is reported? And yes, B is the correct answer because here the guideline is that if the patient has come for the the problem and if you are treating the problem. Second question, Roger has a cancer in the lower inner quadrant of his right breast with a secondary cancer to the bone. He's been treated for his metastasis cancer. So what code you will write first? So he has a primary cancer, he has a secondary cancer, and the treatment is directed towards the secondary cancer. So think and tell me the correct answer. So yes, D is the correct answer because here the treatment is directed toward the metastasis cancer. So we are going to have C79.51 first and then the second. And the second code is basically the lower inner quadrant because this is the upper inner quadrant and in our case it's a lower inner quadrant. So D is the correct answer. Next example, Teresa, 52-year-old female with a primary breast cancer, arrives at his PCP's office with a complaint of tiredness and fatigue. The physicians diagnoses the patient with anemia caused by the breast cancer chemotherapy treatment. The physician wrote the patient a prescription of the iron tablet and administered B12 injection. What are the correct ICD and ICD-10-CM code? So what has happened is the patient has developed anemia due to the chemotherapy and this chemotherapy is directed towards the female primary breast cancer. Now go through all the code and tell me the correct answer. So yes, D is the correct answer because the treatment is for the anemia, and that anemia is mainly because of the chemotherapy. So always remember the anemia code goes first, followed by the cancer code, and then the last code is the adverse effect. So this is how we are going to code this. A 67-year-old patient with a known diagnosis of the ovarian cancer is admitted specifically for the scheduled intravenous chemotherapy. So what is the today's encounter is the administration of the intravenous chemotherapy. So that's a big clue, and these are the options. Go through it and zero down your answer. So yes, B is the correct answer because this is the code for the intravenous chemotherapy and this is the code for the ovarian cancer. And since the encounter is for the chemotherapy, that code will go first. A 62-year patient with a known history of right breast cancer now present with a severe left thigh pain after minimal trauma. Imaging shows a pathological fracture of the femur due to metastasis bone cancer. The patient is admitted specifically to treat and stabilize the pathological fracture. No active treatment is being provided for the primary breast cancer during his encounter. So this is the guideline where the focus is the fracture treatment, not the cancer treatment. So you know the guidelines. So zero down the answer. So yes, D is the correct answer because M84.552A, it talks about the pathological fracture of the left femur, and that has been written here, that fracture of the femur, and it is a left thigh, and then this is mainly because of the metastasis. So we will consider C79.51, not C50.411. So D is the correct answer. Now there are few more questions which I have given. I want you to go through all those questions and solve them on your own and tell me which guideline did you apply to come up with the correct answer. I have even given the answer also, but I would like all of you to tell me whether that is the correct answer and why did you choose that answer. So this is my last slide and I'll see you in the next chapter presentation.